Good morning, everybody. Good morning, all the participants. Respected Meenu ma'am, who is the executive director at AIMS Rishikesh, and she is the co-chair for Cochrane India Network. And respected Professor Dr. Sumanth Nagraj Kumargere, who is the guest speaker of today's webinar. So I welcome you all participants to webinar 10 under the platform of advocating the findings of systematic review by Cochrane in dental practice. Today's webinar actually is the experience learning that we have done from our past 9 webinars, wherein we have seen that most of our systematic reviews end in an inconclusive result, and probably after much discussion we realize that there is lack of studies, or there is a gap, or there is literature but it is not reaching the clinicians. And so because of all these gaps, we thought that today we should be doing a webinar on this very important topic of priority setting in dental research. So, before we move ahead, let me introduce to you the speaker of today. Sumanth Kumargere Nagraj is a senior researcher at Magic Evidence Ecosystem Foundation, Norway. Sir is a clinical editor, Cochrane Oral Health Group, and co-convener at Cochrane Methods Group. Sir is having MDS, MPhil, MSc, PhD, and is a FAMER Fellow. With 22 years of experience, he has worked as a faculty in India, Libya, and Malaysia. Presently, he is working as an honorary research fellow at Department of Surgery and International Science, University College of London, and is also having 86 publications in various national international journals. Sir is a peer reviewer to 20 journals, and Dr. Sumanth has undertaken various priority setting activities for the Cochrane Oral Health, for priority setting of oral cancer and pre-cancer research in Malaysia and India, setting priorities for dental education research in Malaysia, setting priority for pre-cancer research in Malaysia and India lead, published a blog in research priority setting, participated in James Lind Alliance priority setting process of Cochrane Tobacco, and many more. So, before I move on to our main session, I would request Meenu ma'am to please give a welcome address, and then we would move on to Dr. Sumanth. Ma'am?
Thank you, Dr. Pradnya, for starting these webinars. Actually, Dr. Pradnya had been doing the findings of Cochrane reviews and discussing them with the authors, and trying to have the perfect platform for dissemination of findings of Cochrane reviews, and they have been much appreciated by the Cochrane India as well as the Cochrane Central Group. So this particular meeting today that we are having, that is about priority setting. And we know that there is a definite methodology of developing priorities, and this is just a beginning of an introduction to various priorities as you think would be relevant in global as well as in research in India. We should be discussing about that, and for different age groups and for different settings, these are important. So I'm really very happy to be associated with this meeting today, and I'd like to welcome Dr. Sumanth, who's from the Cochrane's Methods Group from Norway, and he will be the main speaker for today.
Thank you, ma'am. Over to you, Dr. Sumanth.
Thank you, Meenu ma'am, Dr. Pradnya, for inviting me for this talk. Can I share my slides?
Yes, sir.
Can you see the slides?
Yes.
Okay. In between the talk, if there are any questions in the chat box, please inform me, Dr. Pradnya.
Yes, sir, just a second. I would like to request all the participants that if you have any comment to share or want to ask any question, please type it in the chat box, and everybody's comments will be read and will be discussed. Thank you so much. So you can start.
Okay. Good morning, everyone. Thank you for attending this webinar. Thank you for inviting me for this webinar. It's always a pleasure to be with Indian colleagues to talk about the research, to talk about what's happening in the country, how we can improve the research scenario in the country. Today's webinar, I have kept basic 4 learning objectives. At the end of this lecture, the participant should be able to define the terminologies, priority setting, and stakeholder engagement. They should be able to understand these 2 terminologies. Describe methods used in research priority setting exercise. Visualize the status of health research priorities at global and country level. And lastly, explain the need for a research priority setting in oral health care. These are the simple learning objectives what I'm planning to achieve in this lecture. So before we go to the actual lecture, please use your cell phone, scan this QR code, and uh, just answer this question. How did you choose, or how are you planning to choose your research topic or a dissertation topic, or whatever research you have done? It could be a master's or it could be a PhD dissertation. How did you choose these topics? What made you choose these topics? I have given you some options. You can tick those. And if you feel that it is a different reason, there is an option others. Maybe you can just type the reason. How did you choose the topic? If you face any technical issue accessing, please let me know. Okay, I'm getting the results here. People have chosen different reasons. Personal interest in the topic. Some have chosen the topic was suggested by their supervisor. Some have chosen the topic will benefit many patients. Some have chosen this topic will be helping me in my clinical practice. And some have chosen the topic appeared feasible. And the majority have chosen the option the topic was suggested by my supervisor. So that's how we choose the topics as of now. Okay, that's great. So let's come back to the topic. So traditionally, this is how we are choosing the research questions. We have various limitations. We have various difficulties in choosing a research topic. We are bound to certain rules and regulations. So that's how we choose a research topic. Health research questions are driven by the interest of researcher or the funding agency or the disease burden or built on the research gap and sometimes what is feasible. This is how everybody of you have answered in today's survey. But is there any problem in this? Is there any problem by choosing the research topics with this practice? Yes, there is a problem because with the limited resources and the increased demand for evidence to underpin decision in healthcare, we must choose research questions which are a priority to all the stakeholders. We as doctors are answerable to the society. We as researchers are answerable to our patients. So we should be choosing those research topics what the stakeholders or what the patients value. Literature shows a mismatch in the priorities for the treatment research between research communities, patients, and clinicians. For example, researchers or as a dentist, what is the most preferable research for me? We prefer drug trials, we prefer a material trial. But patients, if you ask, they may not be preferring any drug trials at all. And this is much evident in the literature. And there is a very famous statement known as 1090 gap. That is the idea that only 10% of the global health research is devoted to conditions accounting for 90% of the global disease burden. This clearly tells us that how much mismatch is happening between the ongoing research and what is needed for our patients. So let's come back to the phrase priority setting. What is priority setting? Priority setting is nothing but you are prioritizing something over the other. So in the healthcare sector, what are you prioritizing? You are prioritizing, or it's a process by which different healthcare program and services are prioritized or ranked. For example, if you are having 5 different sections: health budget, disease level, intervention level, drug level, and research level. So how are you going to prioritize your research? Now let us talk about the drug level. Life-saving drugs are prioritized over the maybe the vitamins or maybe the painkillers. Intervention level, surgical interventions for emergencies will take over as a priority compared to other interventions. So at each level, prioritization can happen in the health sector. But at research level, what prioritization is done, what research should be given importance, what research should be prioritized, that is known as research priority setting. So now come back to the question, do different groups of people have different health priorities? This is a very burning question what we all have today in this webinar. Why should we do prioritization? Does every person have different thought process? Do they think that different research topics should be researched? Yes, it is very much true, and this was evident way back in 2010 itself with this burn project. This is an interesting project. In this burn project, the burn survivors were asked what research should be done. What is the most important topic researchers should take up in this particular project? And the burn survivors prioritized itching and edema. They asked the researchers to do research how to manage itching and edema on scars. And like the researchers were surprised. They were telling, is that the priority? Itching and edema? Do you seriously think that this is the priority topic? For them, it was a priority topic. But for the researchers, this was not even in the list of their priority topics. Researchers were thinking which graft versus which graft is better to treat the patients. But when you go back to the burn survivors and ask them, their priority was totally different from what the researchers were thinking. Similarly, another study done in Bangkok, health professionals listed infection, addiction, and violence as their top 3 priorities, whereas the slum dwellers prioritized sanitation, flooding, and health services are their top 3 priorities. So you can see a clear mismatch between what is happening from the researchers and what is expected from the end users. So this is the blog what I wrote way back in 2020. You can see in this blog that A ordinary lady who stays in a village might be thinking which is better to use to clean her teeth, whether it is a neem stick or charcoal powder. Whereas a person like Einstein might be thinking, okay, should I use a regular toothbrush or should I use an electric toothbrush? So there is a clear difference in the health priorities or the research priorities between the different groups of population, socioeconomic status, ethnic groups, countries, gender. So this variation is very much evident in today's society. Similarly, when we check different groups of people, do they have different health priorities? White American adults, they showed that they are more interested in preventive aspects of dentistry in contrast to Asians and Hispanics in the same country. Asians and Hispanics were more bothered about managing the pain, but Americans were more bothered about saving their teeth or the preventive aspects. Similarly, when we checked the literature in Malaysia, we saw that Malays and Indians attended dental clinics because of the pain and or seeking dental emergency services, whereas the Chinese population utilized the dental services for checkup and dentures. So even the utilization of the health services varied because of their own set of priorities. So what is research priority setting or priority setting in health research? It's any interpersonal activity that leads to the selection of topics and or choices of key questions to investigate. So coming to how do we do the research prioritization, we choose normally the research questions and we start with the research. But in research prioritization, this doesn't happen. We get together all the stakeholders, including the funders, and we ask them to list down the different research questions, and we see if there is any mismatch in the understanding or in the research priorities of each group of stakeholders, and then we involve the stakeholders to understand why is this reason, what is the reason there is a mismatch, how can we bridge this mismatch. That's what is going to happen in research priority setting. So this is just a gist of a research priority setting exercise as a whole, but let us go to the nitty-gritty of this process. So, who is a stakeholder? It sounds like a terminology borrowed from business management, but actually, we are directly or indirectly dealing with stakeholders in our everyday practice. So, we can classify the stakeholders based on 7 P's, that is, healthcare providers, the people who purchase the health services, payers, could be the insurance agent, could be a company, patients and public, the policy makers, product makers, especially in dentistry, the dental material makers, and all the principal investigators of research groups. All these are the stakeholders, and any research question should come through all these 7 concepts, or 7 people should be able to prioritize the topic and tell us what is the most important research topic that we need to pursue. So now let's go back to another activity. Please use your mobile and scan this QR code. I have given you a title, which is a very good publication I saw recently in one of the Indian journals. Oral and Dental Care Before Radiotherapy, Guidelines and Development of a Time-Bound Protocol. So basically this paper is aiming to develop a guideline how oral and dental care should be taken care before the patient goes for radiation therapy. And when I read the paper, I understood that this protocol was designed within a small group of researchers. So I was interested to know who are the stakeholders that they should have involved before publishing this work. So please think, and maybe you can choose the list what I have given in the questions, or if you feel that there are any other stakeholders for this topic, please add in the section others. Yeah, you can choose multiple options. Okay, looks like everybody are choosing dental surgeons mandatorily. Some have chosen radiologists, radiation oncologists, some have chosen patients. Excellent. Some of you have chosen even health insurance representatives, guideline development bodies such as ICMR. Brilliant. I agree with your opinions here that it's a topic which needs multiple disciplines to concentrate. In this particular topic, since you are developing a guidelines and this guideline need to be followed by the group of healthcare workers who are into the system, you need to involve everybody in the system. It starts from anesthetist, it starts from your radiation oncologist, it also goes to the dentist, patients, the carers of the patients, the insurance company which is going to pay the money for the dental treatment before radiation therapy. All these people are the stakeholders in this particular research activity. So why I have kept this activity in this webinar is to give you an idea that whenever we are doing research, we cannot do the research in silos. We can't think that, okay, I and my research team will just do this research, we will publish this. It may not be relevant sometimes to all the stakeholders, and that entire research activity becomes a mere waste of time. So whenever we are doing a research, first question to us: who are the end users of this research? Who are the stakeholders of this research? Is the question relevant to all those people? Do we need to modify according to the needs of others in the stakeholder group? All these questions we should ask ourselves, and then we should proceed with the research. There are 5 different levels of engaging stakeholders in research. A majority of us, what we are doing is at the base level, that is, we inform or educate our stakeholders. We do a lot of education programs. We give some talks, health talks. We distribute the pamphlets. Sometimes we consult the stakeholders. We get patient feedback, especially in dental colleges. Some colleges are practicing the feedbacks. So we are getting feedback that is at a consultation level. But the upper 3 levels, that is involving the stakeholders, collaborating with the stakeholders, and empowering the stakeholders, is happening in a minimal level, especially in majority of the LMIC countries. So what do we mean by involve? Involve means we are making the patients work directly throughout the process. We are taking them as a partner in the process. That is collaboration. And lastly, empower means we are giving the decision making power to the stakeholders. Here the patient can be a co-author of your research. He can be in the ethics committee, or the patient groups can also be there in the funding agency to decide whether the funding should be given to this research or not to be given. So such empowerment is given to the patients or other groups of stakeholders. So these are the 5 different levels of stakeholder engagement methods. Now, this is a symposium or a colloquium that is happening in September, Cochrane, London 2023. When I was discussing about submitting some abstracts with Dr. Pradnya, she asked me a question: why are patients included in this colloquium? There is a section in the website, patients included. So why are they included in this section? So what do you mean by patients included? You can see here the 5 points charter of Cochrane London 2023. It says that participation of consumers in the design, planning and delivery of the event, funding and expenses, accommodating disability requirements, and facilitating virtual access where possible. So here they are at the level 5, or they are at the highest level. They are empowering the patients. The patients are a part of this conference. They are in the organizing committee. They are planning. They are giving the inputs for the delivery of the event. Even they have been given grants to attend this colloquium. And even they are looking at the accommodations for disabled individuals. So all these things are something what is happening in the world today, that is empowerment of the patients. Next question is, why should we engage stakeholders? A very famous statement goes like this: nihil de nobis sine nobis, which means nothing about us without us. If you are talking about my health, involve me. So why should we involve? First thing is accountability. We as researchers, we are accountable to every rupee spent on research. We are accountable to the country. We are accountable to the patients because of our professional ethics. Then second one is, we need to understand the values and priorities of the patients, without which we cannot implement the treatment. The third reason is, we are minimizing the chances of overlooking research priorities by involving different stakeholders into the research priority setting activity. We as researchers, we as dentists, we have a lot of scientific knowledge, but patients have got a lot of experiential knowledge. When we and patients sit together and decide the research topics, then it is a combination of scientific knowledge and the experiential knowledge what patient has got, that can result in beautiful research questions. And lastly, when we involve all the stakeholders in deciding the research topic, that gives them a sense of ownership and acceptance. This acceptance will lead to successful implementation of our research answers. So these are the reasons why we should involve all the stakeholders in research priority setting. What will happen if we do not prioritize research? And in today's era, the biggest problem what we are seeing is research waste. When we do not prioritize the topics, it leads to research waste because of the mismatch what clinicians do the research and what patients are expecting from clinicians to understand or to use the research. It is an interesting graph. You can see this graph and try to understand. I'll explain this. In the x-axis, there is relevance to the immediate application. It starts from low application to high application. Whereas in the y-axis, you see relevance to the advancing knowledge. There is low advancing knowledge at the base and high advancing knowledge at the top level. So if we map all our research topics, in some or the other quadrant, our research topic is going to be allotted. Now let us understand what is this graph. Now, if you are doing a research without much relevance to the practical issue, probably some basic sciences, molecular studies, cellular studies, there is so much of knowledge in that, and there is so much of new advancement in that knowledge. Such studies will fall in the Curie quadrant because it's named after Marie Curie, who did a lot of research in the basic science. Suppose you are doing some research which is more useful for practical questions. For example, how to deliver the drug, how to reduce the cost of a drug. So that falls in the Dahl quadrant, named after Robert Dahl, who did the studies, that is association studies between smoking and lung cancer. And if you are increasing the knowledge and if you are increasing the applicability, both the aspects, then it falls under a Pasteur quadrant, named after Louis Pasteur, who did the basic microbiological studies. If your research doesn't fall in any of these three quadrants, if there is low knowledge and if there is low application, then it goes to the research waste quadrant. So this research waste quadrant is growing in size in the past decade. That means we are doing a lot of research that is neither giving or adding new knowledge, nor it is been of use in the application aspects. So this research waste needs to be avoided. And how do we avoid this research waste? One of the answer is to prioritize our research questions by involving all the stakeholders. This is another graph which shows the mismatch between what is expected by patients and what are we doing as researchers. Let us start from the right end of the graph. You can see there are registered commercial trials. And if you look at the registered commercial trials, almost 85 to 90% of the trials are happening on drugs, vaccines, and biological agents. Whereas if you ask the patients what do they want us to do research, if you see hardly 20% of the patients or stakeholder groups are asking us to do research on drugs and vaccines and biological. So what is the maximum opinion gathered in James Lind Alliance? Almost 60% of people are expecting us to do research on education and training, service delivery, psychological interventions, physical interventions, exercise, complementary medicines, complementary interventions, diet, and such areas are prioritized by the stakeholder group. If you compare what is expected by the stakeholder and what is actually happening in the commercial trials, there is a clear mismatch between the expectations and the practice. Again, this is another table taken from one of the journals. This journal has published this article where they have studied new questions or new trials from 5 different medical journals. And these are some of the claims given in 2009 and 2012. 5 clinical trials mentioned the same topic, that they are the first one to address this topic, and all the 5 have claimed that. And one of the trial has used a systematic review as a justification to do the trial, whereas 10 trials in 2009 and 13 trials in 2012 did not even bother to use the previous systematic review to design their trial. And some of the references quoted by these trials, only 4 randomized controlled trials references were quoted, whereas in 2012, 10 previous trial results were quoted. And lastly, 9 of the trials didn't even bother to quote the references of previous randomized trials, and in 2012, 6 such trials didn't even bother to quote the previous randomized controlled trial results. So why I'm giving this example is we are always looking at the first part. We want to be the first one to address a question. We are always very much eager to say that yes, we are the first ones to address this question. Our study is very unique. Nobody in the world has addressed this question. We are always going behind such type of mentality and such type of claiming business that leads to lot of issues, lot of research waste. So how is the research priority setting done? In the beginning, Meenu madam just explained how briefly the research priority setting can be taken up as a workshop. In brief, if you want to know how it is done, first we need to identify stakeholders. We did that exercise in the previous question. Then we need to understand the context. Why are we doing this research priority setting? Are we doing at a regional level? Are we doing at a national level? Are we doing at the university level? Then we need to ask different stakeholders to identify research questions. Once we have a set of questions or topics, we need to prioritize those questions. We can use different matrix methods for that. Once we have a set of questions, it's not only the end of the research. We have to start disseminating those questions. We have to propagate these questions to all the researchers and tell them, look at this, these are the top 10 questions. We need to do research on these areas because this is the need for society on today's date. And lastly, we need to go back to the stakeholders and ask them, see, these are the 10 questions we have prioritized. Do you have an appeal? Do you want to revisit this? Do you want to evaluate this and tell us to do some changes? And this becomes a continuous cycle, and this keeps on going on. And different bodies have decided different timelines to do the research prioritization exercise. For example, some of the international bodies have decided to do it every 3 years, like James Lind Alliance does it every 3 years. Some of the national bodies have decided to do it every 5 years. So it depends on what topics you are interested in, what are the resources you are having to conduct this cycle. There are different methods to do research priority setting. I will not go into the details of this, but I'll give you an overview of research priority setting methods. Basically, we have two methods. One is based on the historic data. That means we will use the publications, we will use the policy papers, we'll use previous statistical data and do the priority setting. And the second one is the forecasted data. That means I anticipate something in future and then I foresight that and then do the research prioritization. So there are four methods for each of this. For the historic data or the compound approaches, we have four different methods. There are many other methods, but these are the four ones which are commonly used. ENHRA or Essential National Health Research Approach. Here, it is done at a country level, and if there is no reliable data, then it is not possible to do this method. In the child health priorities approach, here we consider the voice of stakeholders and wider public and then take their opinion. In the burden of disease method, we look at the health information system and see what are the more common diseases that are happening in the country, and then we prioritize research questions on those particular topics. I think presently India is practicing the burden of disease method, where they check the number of patients who are suffering from different diseases. So the priority is given for malaria, tuberculosis because of the burden of the disease. And the last method is 3D CAM. That is, there is a three-dimensional view of historic data. One is public health, second one is institutional dimension, and lastly the equity dimension. So these are four approaches based on the previous or existing data. Forecasting method is something as a researcher or as a stakeholder, you forecast or you predict what could be the next 5 years priorities. So most commonly used method is a Delphi exercise. Here you are involving all the stakeholders. It's a sort of survey. You ask them to forecast research topics. Roadmaps, it is something like that, like you are asking the stakeholder to give specific actions for specific research. Visioning is done by an organization or a community based on their principles and what they want to bring into the research. And lastly, scenario creation. Very few countries or very few organizations are using this. It provides a picture of what future might look like, and based on that, you will do the forecasting of the research priorities. I'll just go in bit detail with the Delphi technique because it's more commonly used. In Delphi, we do a focus group discussion with the stakeholders and we obtain at least 50 research questions. It can also be done through a survey. So we have maximum 50 questions with us. Then we circulate these questions to the Delphi panel members. We ask them to give ratings. If there are 50 questions, we will ask them, okay, choose top 25 or top 20. We give a Likert scale of 1 to 9. And then this survey is done at least 2 rounds or 3 rounds until we reach the top 10 questions. These top 10 questions are now the research priorities that will be circulated among the researchers. So has any research been done based on a research priority setting exercise or a process? Yes, definitely. I have listed 5 different questions here, which are also published. These are the 5 research topics which have been engaging the stakeholders, and they have worked, stakeholders has worked as even the key authors of the studies, and they have published these papers in the scientific journals. Coming to the global level, research priority setting is done by many agencies. One of them is the James Lind Alliance. James Lind Alliance has set up top 10 questions for different fields of the health. You can see in this website, it starts from like acne, adult social work, advanced heart failure, alcohol related liver disease. Like each section or each health issue, they have prioritized top 10 questions, and in the bracket you can see when was the research prioritization done in which year. So if you come to the oral health, JLA or James Lind Alliance has come with the top 10 research priority questions in year 2018. And these are the top 10 research questions they felt that are needed in urgency, that research has to happen in these 10 areas. Now it's time to us look at these 10 questions and think what research currently we are doing. Is it in this top 10 priority questions? If it is not, then we have to question ourselves, is it really worth pursuing such research which is not even in the top 10 priority for the stakeholders? Sometimes the research priorities, what is listed here, may not be matching the urgent need of our country or our community. So this is where we have to sit and think at a national level. Do we need a priority exercise for our country level, or do we blindly follow the global priority setting questions? So there is a website known as Health Research Web, which has documented all the research priority activities going around the globe, and they are giving all the details of the research priority activities. And when I wanted to know the research priority exercise, if anything is registered under this website, I wanted to check for India. I found nothing. In India, none of the health research priority setting exercises have been documented in this website. Maybe they are happening, I'm not sure, but they have not been registered in this website. When I check the literature, are there any publications related to the research priorities? I could find some publications related to the research prioritization exercise, especially in the field of psychiatry, in the maternal newborn child health nutrition, and in the lymphedema aspects. But when I wanted to know, is there any such activity for the field of dentistry, no, I could not find anything related to the field of dentistry. And I also tried looking at the website of ICMR. They had recently announced a short-term grant application. So in that they have listed the priority diseases and conditions. In this list, what I could see is just a small area, oral health. Which part of oral health are they interested in? I'm not sure. So this is the present scenario of research priority setting, especially in dentistry in India. So what can we do as researchers? We need to increase the awareness and trainings on research priority setting. National level research priority setting in healthcare, including dentistry, should be happening. All stakeholders, including the funding agencies and the specialty related organizations, we have, every specialty has got a very strong organization in country, so those organizations should involve in the research prioritization exercise. And our postgraduate research should be strengthened by using these research priority questions, and they should be working on the questions, what is the prioritized topics, or the existing systematic reviews cannot answer those research questions. So how can we do this? We should use the existing national conferences, symposiums, because most of the specialty people, postgraduates, are attending these conferences. And we can use half a day of our conference and do a Delphi exercise. We can prioritize the questions for that particular subject. Then disseminate the top 10 priority questions for next 5 years, and we can make something like a policy that all the postgraduates in this particular field should take up their master's work based on these top 10 questions. So at the end of 5 years, we would have collected beautiful data for these top 10 research priority questions, and that would have answered so many of our burning issues. We have a separate Cochrane methods priority setting group. It's under the methods group of Cochrane. We have different people working from India. Soumyadeep Bhaumik is there, and I am there in this group. It's led by Mona Nasser, who is a professor in epidemiology and evidence-based healthcare. And if you need any or if you have any plan to do research priority setting exercises or a collaborative project in this particular area, you can always contact either me or Professor Mona Nasser. We are very happy to train people for this research priority setting exercise. So with that, I come to the end of my talk. I sincerely thank Dr. Pradnya for contacting me and the Team Cochrane India Network and Postgraduate Institute Chandigarh for giving me this opportunity to share my experiences in this particular field. Thank you. If you have any questions, I'm ready to take the questions now.
Thank you very much, Sumanth, for that brilliant talk and introducing the topic to all the people, all the stakeholders, I would call them now. And I think we need to do such exercises very often. And I would like to know from you how you incorporate your prioritized topics into health research. In, what are the methods which you are supposed to use? I mean, this is one step ahead of setting priorities. After you've set priorities, how do you go about implementing them?
Yeah, ma'am. I have not worked in a government institution or at a national level, so I would not be able to answer you at a national level how do we incorporate these top 10 research questions. But definitely, I can tell you my experience with the Cochrane. In Cochrane, we started this research priority exercises way back in 2015. And initially we involved all the consumers and the authors to prioritize the research questions. Later, we extended this to funders and other stakeholder groups. So once we got the top 10 research priority questions, what Cochrane decided was they will cater those systematic reviews only which are falling under these top 10 research questions. That is one way of ensuring that all the top 10 research questions are addressed in the Cochrane systematic reviews. They also had a pressure from the funders so that the funders were also interested to know what Cochrane is doing is something worthy for the stakeholders. So this when top 10 questions were the most important topics for the Cochrane systematic review, every Cochrane author now started working on the priority areas. So this was one of the method how they disseminated and how they made us work only for those top 10 research questions. The other method, as I suggested, it can be at a national level where you can, at the ICMR level or at the national funding agency level, you can tell we will fund those research questions which fall into the top 10 categories. We are unable to fund other research topics. So if you announce such policy decisions, then everybody are forced to do the research what is most important to the stakeholder group rather than what is most important for themselves. So this is my experience, ma'am. Have I answered your question, ma'am?
Yes, yes. I think your experience is going to be very helpful. Dr. Pradnya, you could actually moderate the
Yes,
talk.
ma'am. Thank you, Dr. Sumanth. I would like to ask a question. Now, in the dental college, we have a scientific committee and one representative from each of the different branches. So, is it like every department should do this priority setting and then come together at a institutional level to set a list of priority topics wherein the postgraduate students can take up certain topics for their dissertation work?
Research priority setting at such a micro level, I would not suggest. My suggestion is to take a research priority setting exercise at a national level, especially when we have such strong associations. For example, we have a very strong oral medicine radiology association with 2000 members, and every year national conferences are happening. So if they can decide what are the 10 burning questions for the field of oral medicine and radiology, then that 10 questions can be propagated to all the postgraduate departments in the country, and it can be told to them that encourage your postgraduates to take thesis topics or dissertation topics on these 10 questions. If you want to do at institutional level, it becomes a real challenge, and lot of resources are needed for you because you need to involve so many stakeholders. So I would not suggest this at an institutional level, but at an organizational level or at a national level would be a better choice.
Thank you, sir. You had shown a list of those priority topics which were decided by James Lind Foundation. Now, what I see from all those 10 topics, they're all directed towards the public health, oral health. But we have 9 specialities in our dentistry. So, other specialities like periodontist or oral surgery and others would say there's nothing for me to do in that. So I raised a question at the institutional level. If the associations are not doing it right now, but after this webinar, if somebody is sensitized and they want to do this exercise at their college level, and because in their local area probably different kinds of problem exist when compared to somebody doing at a national level, so can they do it is what I wanted to ask.
Yeah, institutions still would be a very micro level of doing prioritization. Yes, state level, I can understand there are some states with different health needs. So at state level, if you recognize that such health needs are there, yes, you can take up this exercise at state level or even the regional level. Let us not talk about state, let us talk about regional levels. So you can do that. And coming back to these top 10 questions, not related to all the subjects, these are the questions what patients want, what all stakeholders want. They are not interested in 9 different subjects of dentistry. They are interested with their problems. Unfortunately, if all the top 10 priorities are related to public health, it's not anybody's mistake. It is a priority. Obviously, that is what society needs. So this is where a lot of funding and lot of investment has to happen, because there is an imbalance between these health issues in the global level. So that's the reason they have been prioritized. Maybe after 5 years, the scenario will change. And again, this is at the global level. If you feel at the country level, there will be a different sort of prioritization, then yes, we have to do that at a country level and see how different are we. And if we want to break down it to 9 different specialities and tell, okay, we want to identify at specialty levels, each specialty organization should take up this as an exercise and go ahead with that.
Yes, thank you, Dr. Suman.